Good evening and welcome. I'm Dr. Barry LaBine. I'm a board-certified dermatologist and I'm the owner and medical director of Refine Dermatique Aesthetic Center. Thank you very much for attending our virtual event tonight. We greatly appreciate you taking the time to join us and listen, and we're very excited to have you here. The event is twofold. One is we get a lot of questions about our lasers. Which laser does what do the names stand for? So we're going to try and spend a little bit of time tonight just going through those basics, because I think once we explain them, they'll be easily understood, and it'll make a lot of you feel a little bit more educated and less anxious about some of these systems. The second is that we have a new laser that we're adding to our aesthetic center. We're very excited about that. So we're going to introduce that, discuss that tonight. And then we also have one other device that we're adding into our aesthetic center that we're going to mention. And we're also very excited about that, to expand that into our clinic. So thank you very much again. And without further ado, let's start our talk. Before we start talking about laser systems, we really need to talk about skin for a few minutes and how we age, because that's important to understand how our skin and structures change as we age that make us look older. So if you look at a person as they age, there are many things that change, but there are a few factors that really make us start looking older. We start losing collagen and elastic tissue in our skin, so we don't have the support like we did when we were younger. We start losing some of the fat in many of the areas of our face. And we also start losing some of the bony structures. And what happens is we then start losing some of that 3D support that we have in our face. And as time goes on, instead of being that nice, fully filled type face, we start hollowing out along the temples and along the cheeks. And as you can see, that whole facial structure changes. When we start losing volume in our mid-face, we start losing that 3D structure, and that's when we start getting these so-called jowls. That's normal aging. Anything we can do to try and slow down that aging process will help us to continue to look younger. The skin itself really changes as we age. And as you look at the skin in somebody that's in their 30s, you notice that they have a nice, thick epidermis. They have a very strong attachment between the dermis and the epidermis. The dermis itself has nice, what we call lattice structure. We have good support underneath there. And if you look at a cross-section of the skin, we have just an abundance and nice cross-hatching of our collagen, elastic tissue, and some of the other molecules that supply support for us. As we start aging, however, that skin starts thinning out. This attachment along the dermal epidermal junction starts weakening. This tissue down here starts breaking down. The collagen and elastic tissue, we don't have as much. It's not cross-linked as tightly. So we start losing some of that support. And what happens then is you start seeing some of these changes with the so-called wrinkles or rhytids in the surface. This continues to get accentuated as we move down into our 50s and our 60s. And as you can see on the last schematic, that the skin is definitely thinner. The support structure is definitely weakening. It's not as cross-linked, and we're just losing collagen and elastic tissue as we age. So what we're trying to do is we're trying to combat that. We're trying to help slow down the aging process. We can't stop it, but we can definitely do some things to improve that. One thing that's really important is that there are external factors that accentuate that or speed that along. And one of the biggest things is sun exposure. So chronic long-term sun exposure accentuates that entire process. It speeds it up. And all of you know people that spend a lot of time in the sun and they're not careful. They always start looking older than their peers as they start getting into their 30s, their 40s, and their 50s. Now, there are a few things that happen. Number one is the UV light does stimulate the melanocytes down in the epidermis, and that will cause them to start making some abnormal pigment. And you'll start seeing brown, tan, darker blotches that start appearing on people's skin. That's usually from sun. Now, hormones also play a role, but sun is a big factor. It also markedly increases your risk for skin cancer as well. And as a dermatologist, that's extremely important to me. So I tell all my patients on the clinic side that the positive side effect of wearing your sunscreen and wearing your hats and being careful in the sun is not only to reduce your risk of skin cancer, but you're going to look younger when you're older. So I think that's a great side effect. So the sun plays a huge role, but also there are other environmental factors that play a role with aging the skin. Smoking is a big one. Diet. If you eat a very healthy diet, rich in antioxidant food, it will help you significantly. And also staying hydrated and maintaining your weight. Those are all healthy lifestyle things that you can do to help slow down the aging process. So I think all of those things are important as you try and look your best. There are a few key things that I would like to just touch on before we start talking about lasers, because I think when you look up lasers and you start reading about the different types of lasers, it can get very confusing very fast because there's all kinds of different systems and different nomenclature and different wavelengths. But I like to look at things very simply. And what I like to do is break it down into ablative lasers and non-ablative lasers. And what I mean by that is ablative lasers are lasers that vaporize or disrupt the epidermis. And you remember from the schematic, the epidermis is that outer layer of skin. When you vaporize or disrupt the epidermis, you will have more downtime, period. So that's ablative lasers. Non-ablative lasers do not disrupt the epidermis. So you're not vaporizing or punching holes in the epidermis. Therefore, you'll have less downtime. Now, they're both important. And some lasers, as we'll see, can have both functions. But that's important because when we're planning laser procedures in patients, it's important to know how much sun damage they have, how much downtime they can afford to have. So as a general rule, non-ablative lasers usually aren't as aggressive as ablative lasers. So if you came in and you were 80 years old and you really wanted to improve your skin, most likely we would need something that's a little bit more aggressive along the ablative line. The other term that I just want to mention, we're not going to go into detail because it gets real confusing, is when you're reading about lasers or looking up about laser terminology, you'll see fractionated or non-fractionated. And I just want you to be aware of that. Fractionated means that it's not entirely treating the entire surface of the skin. It's treating little small microcolumns or pixels. If you're doing a non-fractionated laser, it's treating the entire area. And you don't need to understand all that or go into great detail about that. But when you're reading that, you'll see those terms. And if you don't understand them, it gets confusing. So I think if we look at it simply with ablative versus non-ablative, it's easier to understand the downtime. Tonight we're going to talk a little bit about the Cyton family platform laser. We have that in our facility here, and we have multiple lasers off of this platform. I've been using the Cyton systems for about 16 years now. I do have other lasers as well, but tonight we're going to be talking about these. And I get a lot of questions about the different names. Specifically, I get asked all the time about the BBL Hero versus the Halo. It's confusing a little bit with the nomenclature, so I wanted to spend a few minutes talking about that, because then I think it's easier for people to understand, because if you're starting to throw out terms, it's confusing, they don't understand. So we're going to spend a few minutes tonight discussing those. And actually, sometimes it's scary to think, well, I'm going to have laser. So we actually have a few demos that we're going to show, and I'll talk you through, and I'll kind of tell you what the experience is like. And that kind of takes a lot of the fear and the anxiety out. So we'll first start talking about BBL. And BBL stands for broadband light. It's a light device, and it's an array of wavelengths. And we can specifically adjust the spectrum of wavelengths with different filters. And we have multiple different filters. And by using those filters, we can adjust for certain skin types or for targets in the skin. So it's a great modality. Now, just as an aside, I have been doing BBL treatments for approximately 16 years. Last year, they came out with something called BBL Hero, which was the next generation of BBL. It had double the cooling system, and so we're able to put in 3 times the energy of what we used to. And I can tell you that we've been doing that now for approximately a year. We love the system. It is much more comfortable. I think we get better results. Our patients have absolutely loved it. So it is a treatment that we can use on the face, but we can, with the Hero system now, it's much easier to use it in other areas. Neck and chest are real common. We can do hands, arms. We've done legs. We've actually done full bodies. And so it's a wonderful new modality. So when you come into the office, first thing we do when we're doing Hero is we make sure that all your makeup, moisturizer, sunscreen, everything is off. Your face is cleansed. We pull your hair back to make sure that it's out of the field that we're treating. We then put a headband on you, and we also put eye protection. So anytime you're going to have a laser procedure, a light device procedure, you have to have eye protection, not only the patient, but all the staff. With the BBL, we then use a clear ultrasound gel on your entire face, and we put this all over the face, and it works to help cool the skin with the cooling mechanism to prevent problems, but also helps a light energy into the skin. And this is a motion technique, and we follow an anti-aging protocol, and we can customize that. We actually got Dr. Bitter's anti-aging protocol, and we follow that. But if people have more reds for rosacea, we come back and we can treat those areas extra. If people have more freckles or brown areas, we can go back and treat those as well. So a treatment like this, there's some mild discomfort. It's not bad, a little bit of warmth. It takes approximately 35 minutes or so to do an entire face. It's comfortable. There's no downtime with this procedure. You may look a little bit windburnt, sometimes along the cheeks for a few hours. If we raise a lot of the pigment up, the browns, they'll be present for maybe 10 days or so. It's extremely important that you use good sunscreen afterwards, and that's a must. We put sunscreen on you before we leave. So during the procedure, as you can see, she's chuckling on this one. I'm a talker, so usually we're talking and having a good time. So, and again, we can use it off the face, we can use it neck, chest, various areas. So that is a BBL Hero procedure. And we have different hand pieces and different filters, and it just shows me treating the forehead, but we treat the cheeks, We make extra passes around the lips, the nose, as well as the eyes. And this would be one of our patients. As you can see, this patient had 2 treatments. Generally, we do what we call a corrective series, which are 2 treatments, and we try and do those about 2 to 3 weeks apart. And then we do maintenance, and it depends on your age, but we believe that maintenance is important. As you can see, just from 2 treatments, you can see the changes. The browns are markedly improved. You can see some of the vessels are significantly improved. The radiance on these patients is markedly improved for most people. And they'll just say that their skin just feels smoother and brighter, feels better. And as all of our laser cases, I'm a big believer in sun protection. We have chats about that a lot. But I also believe that good basic products, and we guide you down that path before and after, not only enhance but maintain your results. And that's important to you, and it's important to us, so we talk about that. But I can assure you that this is a happy patient. This one is just an example. We can do other areas, and this is actually a plastic surgeon from Florida. And this just goes to show you how much sun damage people can get. This is called poikiloderma, where they get marked reds and browns along the chest. Not uncommon in this area. And I believe this person had 1 treatment. Now that's an unbelievable result in 1 treatment. We don't always expect that. But we can definitely improve not only the reds, the browns, but the skin texture. It'll feel smoother and it'll look brighter. Now the chest and the neck can feel a little bit warmer after treatment than the face, so we have to be a little bit careful with the energies on that. But again, once you get it in improvement, you need to protect that. And so I'm big on sunscreen, but I'm also big on people that have a lot of sun damage on their chest and wearing UV clothing. So that's the BBL, broadband light, non-ablative, no downtime. You may look a little red in the cheeks for a few hours. The browns can last about 10 days. It is a great treatment to use on any body area. There is no downtime, like I said, but also there is evidence with the DNA study to show that not only does it slow down the aging process, but it reverses it. And so we're big on, once we get it corrected, to make sure that you're wearing your sunscreen, using good products, and we do maintenance treatments. And I think the longest patient I have currently that's been doing BBLs with me is 16 years, and she looks fantastic and she's happy, and those are fun patients. So that was the BBL Hero. Now we're going to talk a little bit about the Halo. So that's another laser. A different laser. So this is what we call a hybrid laser. It's interesting because there's 2 different lasers in one. We have an ablative component and we have a non-ablative component. So we have both. That's unique. That's not common. But what we have found with that is that we get better results when we're combining the 2, and we get a little bit quicker recovery. So it is a laser that has been around for several years. We can use it almost anywhere on the body, but the face and neck are the most common. Because it's ablative, there's downtime with this laser. This is not a laser that you come in and you have it done and then you go right back to work. We have to plan this where you have some downtime. And depending on how we set the parameters, that can be anywhere from 2-3 days, and if we're very aggressive, that could be up to 5 to 7 days. I'm also very picky about sun protection prior to. We have some products we want you on. Before and after, we give you a kit, because there's a little bit of downtime and a little bit of wound care with that as well. But this is a treatment as well that we do have you come in approximately 60 to 90 minutes before the treatment. And we do put a topical numbing medicine on your skin. And occasionally we'll also do some small little nerve blocks as well, just for the discomfort. The treatment itself takes approximately 40 minutes or so. And then afterwards, we usually have you stick in the office for about a half an hour or so, just until that kind of warmth goes out of your skin. And we provide you with written instructions and the whole kit to take care of it. Now, and I'm giving a little teaser to one of the things that we've added, but this is something called Pronox, and we'll be talking about that in a little bit. So you come into the office and we make sure that all your makeup, your moisturizer, your sunscreen's off, your face is cleansed. We pull all your hair back. We put eye shields on. If I decide, because we're doing a deeper laser, that we need to do some nerve blocks, we will do that. Once we're ready to treat you, we have a computerized handpiece. And what we do first is we just measure out all the different zones in the face that we're going to use. And I can customize how deep we are going to go with each of the lasers. And that depends on your skin type. It depends how deep your wrinkles are. It depends on your age and what we're treating. So the beauty is it's totally customizable. We then measure out the areas and we determine how much energy we're going to put in the different zones. And it has a very smart handpiece. It has a temperature sensor. So once we start lasering, in that handpiece we have what we call a Zimmer chiller, which blows cool air to help for discomfort. We actually have vacuum extractor and the temperature sensors in the handpiece. So if your skin is heating up too quickly, it slows down how much energy you can give so it can give it to it safely. When we do this, we treat the entire face, and like I said, we could do other body areas as well. During this type of procedure, at this point, they're comfortable. You might have a little bit of discomfort, and then there's some warmth afterwards. This procedure, you go home afterwards, and you start kind of doing some of your wound cares, and we'll show some pictures of that. But again, we make passes all over the face, including the upper lip, the cheeks, nose, treat the entire face. Now this would be a patient that had, she actually had 2 BBLs first to clean up some of the browns and some of the reds, and then she had a halo. And you can see from the pictures just the change in that radiance of the skin. It's helped. The skin looks a little bit tighter. You can see some of the rhytids or the wrinkles down in the mouth area have lessened. Her pores look better. There's more luminance of the skin, and we definitely helped with the BBLs in improving the pigment. So I think this photo is about 3 months afterwards. So it does take a little bit of time, and you keep getting improvement for almost up to a year because your body is a factory making new collagen and new elastic tissue underneath. And so this would also be a very happy patient. So that's an example of halo. So, and again, we can combine some of these lasers. We'll talk a little bit more about it, but it's very common that we'll do a few BBLs, heroes, to clean up some of the pigment, and then really come back in with a halo and improve things. So just as a summary, BBL Hero is non-ablative, no downtime. It's a light device. We can treat reds, browns. It helps the radiance of skin. It helps with some of the sun damage as well. People that get the BBL Hero will say their skin just feels softer. The texture feels much better. They like the way their makeup goes on the skin. They like the way their skin feels. The halo is ablative, downtime. So we're on the opposite end of the spectrum. We're treating a little bit deeper wrinkles, moderate to severe wrinkles, scarring, such as acne scarring or post-surgical scars, people that have severe sun damage, people that have been out in the sun for most of their life, have extreme sun damage. They've really broken down some of that collagen elastic tissue. It's people that have significant changes in their texture and really need a deeper collagen stimulation. that's the other end of the spectrum. So we've had kind of both ends of the spectrum, non-ablative and ablative. And so one of the things that I always felt that we were missing in our practice is kind of in between. We've got both ends of the spectrum, but what about those people that they want a little bit more than the hero? They want a little bit more, they have some superficial wrinkles, or they want to get a little bit better texture, but they can't spend 5 days or 7 days of downtime. And so we now have added a new system, and this is called Moxie, and it's in the Cyton family, and we're just adding this. It's been around for maybe a year or so now, but we're excited to bring it to our aesthetic center, and I think it's going to give us that complete spectrum of lasers now that we can use for our clients. So what is Moxie? Moxie is a non-ablative laser, but it has a little bit longer wavelength, 1927 nanometers, and it can penetrate down to approximately 200 microns in the skin. So we can get down into the dermis a little bit besides the epidermis, but we're not ablating the skin, so we don't have downtime. So what are we looking for? We're looking for things that we can brighten the skin, tighten it just superficially, pores should look better, skin should feel better. And again, with these laser systems, we can customize and we can do them together. Like, for example, you can do a BBL Hero with the Moxie, same session. And so it gives us just a bigger array of things we can do. We can use this system on the face, but we can also use it on the neck, chest. We can use it on other body areas as well. So this is an example of the Moxie. And this one has a handpiece with a smart adapter as well. With the Moxie, it's a little bit more than the Hero as far as aggressiveness. So with something like this, we're going to have you come in. We're going to, again, cleanse your face, get your headband on, and we're going to put a topical numbing medicine on you for maybe 20 minutes or so. We'll take that off just to take the edge away. At that point, we cleanse all that off, and then we have eye shields on you, and then we treat the areas. And we have a couple of different levels that we can treat depending on your skin type and what your desires are. And we treat the entire face. It takes just a short period of time, maybe 15 minutes or so. While you're having the treatment, it's very comfortable because we've used a topical numbing medicine. We will be telling you what we want for skincare before and after, and you can expect a little bit of dryness and some peeling that's fairly mild. Now, these photos are from aesthetic care given to us from Cyton because we're just getting rolling on the Moxie ourselves. But here's an example of a patient that has had, I believe, just a couple of Moxie treatments, but you can just tell the difference of the pigmentary changes, especially the browns, the mottled pigment, just the improvement to that radiance. Their texture and their pore size has also improved on these. Again, good skincare is really important. And that's just a close-up of the same skin. So as you can see, skin just looks better and feels better. Now you can combine this as well with a BBL and a Moxie. We can do them on the same day and even get better results. Now this here is a schematic kind of showing you the difference of the downtime between the Moxie and the Halo. So this would be pre-treatment, and then this would be day 1 through 5. Now, as you can see, you get a little bit of red on these. The browns you can see a little bit more. Skin gets a little bit dry. The texture might feel a little bit rougher as you're healing. But as you can see with the Moxie, you can go about your business. You can use moisturizers, you can use your products, and we'll tell you which ones you can use. You have to use sun protection. You can wear makeup for females. So, you can go back to work. You may have a little bit of redness, and depending on how aggressive of moxie we do, you may have a little swelling for a day or so, but you don't have to stay at home in your house. Now on the halo, it's a little bit different story. As you can see, you're going to see especially this pigment change, because you get these what we call microscopic epidermal necrotic debris, these little areas of sun damage and pigment changes come up through the surface. So that area looks dark and real pigmenty. If we're doing a more aggressive halo for deeper wrinkles, you're going to have more swelling. You're going to have sometimes a little bit of crusting. And so that's harder to be out in public, and you can't really cover that with makeup. So you're going to have at least a few days of downtime with a halo. So there's the difference, is really the downtime, how it fits into your life. The halo is definitely more aggressive. So if you have deep wrinkles and you have the downtime, we're going to probably swing you into this area. If you have more mild or you want to not have downtime, we're going to look more in this thing. So we can customize these for you. So for us, this kind of fills out our whole suite. So now we have kind of the whole spectrum between non-ablative, and we have a hybrid ablative on this end. But what I think is also unique on this platform, we haven't talked about it today, but I have a few other lasers that we can use, and it's kind of nice to have all of them there, because we can sit down and patients have varying needs. Everybody's skin is a little bit different. Everybody's story is a little bit different. Everybody's areas that bother them are different. So we can sit down and plan out a course on patients. So we can do multiple lasers on a patient in one treatment. And what I mean by that is if somebody has a lot of sun damage, a little bit deeper wrinkles, and we decide that we're going to do maybe a couple BBLs to help with some of the pigment, but they're going to need a halo to kind of clean up most of the areas. But they have areas around their eyes or mouth that really bother them. I have a couple different lasers on this system that we can use to address that. And we have a micro laser peel and a profractional. Both are ablative. We can be a little bit more aggressive in those areas. And so it's very common that we'll customize these treatments. When we do those, we always do them in the fall, winter, and spring. I won't do those during the summer because patients can't be outside. And when we do those type of treatments, not only do people look better, their wrinkles look better, but when we repeat their Visia camera examinations, their sun damage is better. As you can see from this Visia photo that is showing the amount of sun damage, all the darker areas, you can see just a change in the sun damage as well. Now this here would be an example of somebody that was having some deep wrinkles along the mouth area, and their skin looks otherwise great. They've been getting BBLs, they've been doing really well, but this area bothers them. And so what we did for her was we customized this. We did a deep micro laser peel. And so we had to do nerve blocks besides the topical, and we used a laser to basically ablate all these deeper wrinkles. I also treated along her lips a little bit to kind of try and get some of the wrinkles out of her lips. Now, this is a bigger procedure. When we do a procedure like this to get after the really deep wrinkles, and that's an area that bothers a lot of women, you're looking at a couple weeks of downtime, and there's wound cares, and I see you back fairly frequently and make sure everything's healing okay. But they're happy patients once they're healed. first couple of weeks. It's a little bit of work for them and a little bit of discomfort. But as you can see in this photo, it's life-changing. She looks very different in those areas. And you can even see from her lips, there's no filler in those lips. That's all from just lasering in those areas. So she looks a lot younger. She's very happy. But those are committed patients, and we spell that out in advance, and we got to make sure that everybody's on board for what needs to be done before, during, and after. Now, one other thing that we've added now to our practice is a device called Pronox. It is nitrous oxide, or people call laughing gas. And it's a 50-50 mixture with oxygen. Some people out there might say they've had laughing gas in the dental office, and it works well to reduce some pain, but also reduce anxiety. This is like that, but a little bit different in the fact that it's patient controlled, meaning we have a little mouthpiece. And as you saw in one of the videos when we were doing the halo, that was the Pronox. So when you're starting to feel a little discomfort or a little bit anxious, you can take a breath off of this. It's patient controlled, so it's very safe. They've had thousands and thousands of aesthetic procedures done in the United States with no problems. We'll make sure that you're a candidate for it, but it helps the discomfort and anxiety for those of you that get a little anxious with procedures. So we're very excited that we're rolling that out as well. And I think it'll be a great addition to our aesthetic center. We have just a few minutes for some questions here, and then we can't get to all the questions for our time period tonight, but if you want to email questions to info@refinedermatique.com, we will get you back an answer if you email that in to us. So the first question is, how many treatments are required? Depends on what laser you're looking at, and it depends on what your expectations are and what kind of outcome you want. So it really depends on what we're aiming for. So what we like to do with all of our patients that are considering laser, we have you come in and do a consult. We'll take a Vizia, which is a computerized software program that analyzes your skin. And then the person that's doing the consult will go through it with you, find out what expectations you have, what bothers you, how much downtime you have, and then they'll kind of lay out a plan for you. So it really depends. Sometimes it's one treatment, sometimes it's several treatments, depending on your situation. The next question is, when will results become noticeable? Again, that depends on what laser you're doing. When we do the BBL Hero, usually the next day when patients wash their face, they'll say that it feels smoother, it feels better. The browns will take approximately 10 days to lift, so usually it's about 2 weeks with that. When we're doing something like a halo, you'll probably take a couple weeks before it starts feeling like it's new skin and it feels much better. But with ablative lasers in the hybrid laser, you can continue to get improvement for up to a year because your body is making new collagen and elastic tissue. So you can keep showing improvement for some time. And again, I think long term, it's important to be careful in the sun. I think it's extremely important to be on good products to maintain those results. And again, I think things like the BBL Hero and the Moxie, those will be things that you can do for just maintenance. I tell my patients oftentimes, you don't go to the dentist once in your life and expect great teeth forever. So it's the same kind of thing. We need to continue to maintain that skin to get those results. The third question is, how long have you been doing laser procedures? If you count my training during residency, it's almost been 30 years that I've been doing laser, and it's really been fun to see the progression of the laser systems over the last 3 decades. If I look back at the lasers that we had when I first started, they were great lasers, but we've come a long ways. And so the technology has been amazing, and it's been a lot of fun to be part of that. It looks like that's the last question that we have time for tonight. I want to thank all of you for coming and watching this virtual event. If you have the questions, please send them in to info@refinedermatique.com. We appreciate all of you taking the time to be with us tonight, and wear your sunscreen.